Welcome back to another episode of Being Millennial-ish. I am Leslie Dellery. This weekend I'm out visiting my sister who's a surgeon, and we've been exchanging a lot of stories about what we do in our day-to-day. While you might feel like you have a really good sense of what it's like to be a doctor, after listening to some of her stories, I realize I have no idea what goes on behind the scenes at a hospital. So today I'm bringing together a couple surgeons to bring to you the untold stories of being a doctor.
What happens if you have to pee during surgery?
I don't have to pee during surgery.
Honestly, hold it.
Even if it's like 7-hour surgery?
We've been known to practice this Zen art of bladder distension, where over time we build up to longer and longer procedures. So,
being a resident, you start off in shorter cases,
okay,
and then you go to longer cases. And I don't know if it's just me, but I think it's a combination between your bladder adapting and basically
anything.
All I drink are energy drinks, so it might be some renal failure kind of added in there, but I usually only need to urinate anymore like once or twice every day or two. It's kind of scary.
Kind of crazy. What is the funniest thing someone has said when they've woken up from anesthesia?
oh, was it good for you too?
Oh my gosh.
Anytime you do a hernia, an inguinal hernia, you have to, which is in the groin, you have to pull down the testicles if it's a male, because sometimes they get pulled up into your operative site. So generally we do this right before they wake up when nobody will notice anything. But I had a case when they woke him up a little too early, and so as I'm making sure his testicles are there and tugging on his scrotum, he said, "I don't think my wife wants you doing that." And I exited the operating room as fast as I could.
What about if you get an itch during surgery? Do you ever use one of the plier things to get a little scratch? One of the nurses?
Oh, definitely the nurses. All the scrub nurses know that every now and then we'll need to lean over and either use a shoulder or use somebody have one of the circulating nurses come up and scratch somewhere.
So if you're an attending, you could probably ask for it to get scratched, but as a resident, you just suffer.
Rub up against an object that's close by.
Okay.
Sterilely, of course.
What's the weirdest question someone has asked for your professional opinion about?
Well, as soon as I got into med school, one of my aunts started confessing about a weird great toe thing. Her big toe was having some issues, which I did not want to know about.
The weirdest question anyone asked me was, actually, not as a doctor, but within about 2 months, maybe 3 months of graduating college. So, I don't know anything. I just got out of college. I just got into med school. I get this phone call from a friend of mine. He's like, "Can you take a look at this thing on my penis?" I was like, no, I cannot. I am not a doctor
A friend.
Yet. Yes.
Wow.
Have you ever had anything go wrong or be weird when you are examining someone?
So every now and then, with teenage males doing hernia exams. And
What is involved in
so
examining
when you examine for a groin hernia,
Okay.
you have to feel on a male. You get very close to other things in that region, and
Okay.
you may be either more gentle or more rough, and the patient may misinterpret that, or their body may misinterpret that. So
Interesting.
that happens every now and again.
Wow.
No, but I can remember this one time. It reminds me, in med school, I had this co-medical student that we were doing the standardized patient exams for the sensitive exams. They bring in people who are willing to let you do vaginal exams and anal exams. So this guy was very, very nervous, and it was the first time doing this exam, and so he's trying to feel the ovaries in the female, and he was feeling from one side, and he couldn't feel it on that side, so then he was feeling the other side, and he couldn't feel it, so he kept flipping back and forth, but every time he was flipping back and forth, his thumb kept running right over the middle, and every time the standardized patient kept going, "You really need to keep track of where your thumb is." Learning to be a doctor is a big adventure.
That's all we have time for today, but stay tuned until next week where we continue Untold Stories of Being a Doctor.
But if it's a really long case, sometimes you just have to be prepared. So have you ever heard of that SNL skit about Oops, I Crapped My Pants? They make a medical grade version. I'm wearing them right now, and yes, I'm peeing. Just kidding.